This program is brought to you by Emory Healthcare.
We know that the best outcomes have always come at centers that have a multidisciplinary approach. We've adapted that at Emory because we think it's the best patient care. When patients come in, they're going to see experts across all fields, nutrition, surgery, radiation oncology, and we're going to tailor our opinion as to what you should do for your cancer to you specifically, and we're going to guide you through it. We're not just going to offer just what we do or what we know the best, because frankly we have expertise in everything. We're going to offer what's the very best for you based on the evidence, based on the data, based on what you want, and that's what a multidisciplinary approach gives you. You may have more than one option, in fact, and that can be very difficult for patients with prostate cancer. What you're going to find when you come to Emory is you're going to meet experts in the surgical profession and the radiation profession and the medical oncology profession, and we're going to sit down and we're going to tailor your care to you. And you may have options at the end of the day, but we're here to help you in making those decisions, and in the end it is always your decision, and you need to know who your team of support is. If I think the best thing for you is surgery, I'm going to tell you, hey, I think you should have your prostate taken out, and I think this is the best way to do it. But if your option, if you're not a good candidate for surgery or, say, another form of therapy, I'm going to guide you towards the one that I think is going to maximize your outcome and going to maximize your quality of life at the same time. And I think the only way we can offer that is we have a team approach, and we get a lot of experts involved, and we are confident that we know how to do everything. The trick is just giving you the best option for the position you're in at the time you're talking to us. There's a lot of factors when you're giving people recommendations for prostate cancer. One of the big factors is, what is the tumor like? You'll hear things about your Gleason score, which is how a pathologist looks at a tumor under a microscope. Your PSA, whether your PSA is changing over time, how your prostate feels, what it looked like on imaging, what your staging radiology is. But then there's also what we call the host factor, is, the age that you present as, what other medical issues you have, what else is going on in your life at this time. Are you working? Are you retired? What's your family life like? Do you take care of your grandchildren during the day? All these things matter, and there's not one script for everyone, and there is always options, and the options have to do with how to best treat your cancer, which we believe we have all these experts that can treat your cancer, probably the best collection of them in the Southeast. But also, how do we maximize your quality of life at the end of it? We need to give you the confidence that you've made the right decision. We need to follow you through, too. We don't want to undertreat you, overtreat you. We want to make it just right, and we want you to give you the confidence that after treatment you can go on living your life.
The preceding program is copyrighted by Emory University.